Okay, let's go back a slide. So, for those of you who are just logging on or who have been on, just keep in mind that if you cannot hear me, you need to turn your volume up. Secondarily, there is a question and answer Q&A button at the bottom, right there, either on your phone or on your computer, and you can type in your questions, and the computer will save all the questions, and I'll save them to answer at the end. Okay, so we'll get started. Again, my name is Dr. Richard Kim, and this is our monthly webinar. And what we intend to do here is to hopefully explain, hopefully give you some insight on how exactly stem cells solve pain. So let's just start off with a couple of Q&A, some general ones. And this is the kind of questions that we often get from those people who are interested. So Linda S. from area code 518, Mary R. from 518, and Teresa O. from 518 asks very similar questions. What treatment is offered and whether it might help me to understand the treatment? What is a stem cell injection? So what we really hope to go over here is answer all three of these questions, but also really talk about who regenerative medicine helps. Here's a couple more questions. Marilyn M. from 514, Jim I. from 518 asked the advantages of stem cell versus PRP, information about the three topics you described above. So let's go into a little bit further about what we're going to talk about here. I do want to go over the differences between some of the different types of regenerative therapies we have, specifically stem cell and PRP, which stands for platelet-rich plasma. And then we'll review this at the end as somebody else answered something similar. When we as patients think about our pain and then a solution for pain, we all have pretty similar goals. And this is including for me as not just a doctor, but as somebody who has to sometimes deal with my own pains. Is that we want to avoid surgery, number one. Number two, we would like to stop medications. We don't want to become dependent on these medications to take over and over and over and kind of feel like we couldn't do anything without these. And lastly, we want an improvement in quality of life. And quality of life for everybody means something different. Sometimes it can mean simply a walk at night, and for others, it means some high level intense activity. Some of these common goals, we want to be ensured of a couple things. Number one, we want a plan. And in that plan, we want it to be safe. We want low risk, short recovery, and we want to avoid pitfalls. We don't want things that might trap us into either more pain or a prolonged recoveries where we're going to be missing out on life. Here's a couple familiar examples. Number one, we have a retired psychologist who flew airplanes for a hobby, was a runner, competitive, but also did it for stress relief. The back pain really stopped his running. For him, that really meant no more competition, but also no more fun, no more stress relief, and it really limited his flying time. He would say he'd be able to go up 45 minutes later, have to bring the plane down. The second is a chef who enjoyed spending time with his family. That person was in constant motion, moving heavy restaurant equipment, and it was really affecting his work. It made the workday difficult to the point where he started contemplating changing careers. So much of what conventional and normal medicine that we see in both pain management and our primary care sometimes and surgery is that they're missing the target. And traditional treatment limits are look like this. Number one, in surgery, we know that it is something that is permanent. It is invasive. It often requires a long, protracted recovery. Number two, medication. And these are one of two categories. Steroids, typically a band-aid. We know that they might work briefly, but even if they work, they're weakening and they're damaging tissues, and we know that. Repeat steroids means a repeat weakening and repeat damage of that same tissue. So it's obviously a from a risk and benefit issue. The risk can be quite damaging. Lastly, over the counter, we know this can help lessen our symptoms, but the effects wear off quickly, typically within hours, and then you've got to repeat the dose, and then you've got to repeat the dose. And of course, they have their own risk of side effects as well. 2 months after our stem cell therapy, the psychologist was back to running. Ran the 4th of July race here in town, which was a 4 mile race at a 13-minute pace, which was still faster than me. And it gave him the confidence to train for a half marathon with his grandson. That was huge for him. The chef was able to go back to work and work full time, and therefore able to provide for his family. This essentially, in this one picture, it captures what so many of us and so many of you out there are dealing with. When you have pain, you end up with degeneration. And when you have degeneration, it leads to more pain. And then, of course, this cycle repeats itself, and all the while, everything getting worse. We are the third solution. We're talking about something that isn't surgery, something that isn't drugs, that's something that isn't medication. And the beauty of our third solution is that it does come with a high success rate. It is something that provides years of relief. And lastly, this is one of the more important parts, is that it's a guaranteed acceptance, meaning that the cells come from you and go back into you. So there isn't a chance to reject. This graph here is a pretty steady um, uh, example of how our patients improve. Once they start making that improvement, it is something week after week after week after week that they continually see improvement, and something that can they can see over many weeks and sometimes even over a couple months. So, what exactly is regenerative medicine? Sorry, quick water here. So regenerative medicine is a new field of medicine. And even though I say new, compared to antibiotics and infectious disease, relatively new. The goal here is really to restore, not replace your tissues. We want to take that damaged tissue and turn it into a healthy, functional tissue. Different materials are used to restore this health, including number one, platelets, which I'll use the term PRP, which stands for platelet-rich plasma, and of course, stem cells. How do we think about these two things? Typically, PRP is something in the green and yellow circle. So let's just say a small to small medium problem. And then we have stem cells where we look at it as sort of medium to medium large problems. Here's a good video example of what happens with these stem cells is if you could see that the red is bad and the green is good, the green then goes to attack the area of the red and make that better. Red is what we feel as pain, stiffness, sometimes sciatica, nerve pains, shooting, aching type sensations. One of my favorite examples is the Pac-Man problem and solution. If you can imagine the little pellets are inflammation, Pac-Man needs the pellets one at a time. And that'd be a good example of what PRP is. Then to talk about stem cells, that's putting many Pac-Mans onto the screen all at once. If you could do that, then you can imagine the inflammation goes away much quicker. But the goal here isn't to beat the level. The whole goal here is to leave the problem behind, to stop playing the game. And when we talk about stem cells and PRP, we're talking about something that can last 5 to 10 years. So at least not play the game for 5 to 10 years, or at least certainly that has been what we've seen in our office, having done stem cells for over 10 years now. Where exactly those cells come from? So, by and large, a lot of stem cells are coming from the pelvic region, and these are what we call the bone marrow. Or, sorry, this is the bone that we obtain it from, and what we grab from here is the bone marrow, and then this is what we inject into damaged areas, like here in the spine, into those regions of degenerative disc. For us, our timeline, our typical schedule looks like this. Once you come to see us for the consult, we'll obtain the MRI at some point in time. And of course, we have our own MRI here in our office. We'll soon thereafter schedule you for the first PRP, then the second PRP and stem cell, and then finally the third PRP. Once we've completed that, we'll send you towards exercise or physical therapy or chiropractic care. The important thing here is to understand that while we can inject you for pain, strength has to be built, and these are the partners, uh, the disciplines that we use to help develop that strength. What can we treat? So the neck and the back is one of the things that we see the most. Stenosis, arthritis, degenerative disc, sciatica. These are some popular terms and words that you often hear when you go to the doctor, go to the orthopedist, as well as things in the lower body, arthritis, bursitis, meniscus damage or meniscus tears, Achilles tendon. In the upper body, we're talking about rotator cuff issues, arthritis issues, tennis elbow, carpal tunnel. So various parts of the body. Everybody wants to know, but am I a candidate? The best way we can sort of explain this is that if the area that you have pain can be injected or operated on, we can also apply stem cell therapy to there. As long as I can get a needle to that location, we can do that. One of the important things about this is that if you simply have pain, we need to work on a diagnosis, and we can obviously help you with that. When we have an accurate diagnosis, we have an accurate location, which also means an accurate therapy. And of course, in order to help us with that accuracy, we will utilize modalities like MRI, which again, we have in our own office. What if you've had surgery? So the answer is yes. This is where a consultation, in-person consultation, is important. Getting diagnosis, imaging, anything you've had in the past, anything we're going to do in the future, the history, the examination when you come in. Type of surgery is also important. Was it an arthroscopic surgery? Was it a fusion surgery? Was it rotator cuff repair? The frequently asked questions that we typically get are, where will my stem cells come from? So we talked a lot about the pelvis, and we talked about how bone marrow can be extracted from there. In certain conditions that we treat, we may be utilizing fat cells. So that's just fat just taken off of your rear end, much like a plastic surgery. Liposuction is done. How long before you can become active? So when we get through our process, really that third injection is where we want people to become active. So for that window between the second injection, the stem cell, and the third injection is really your most significant downtime. When do you start feeling the benefits? So some people feel the benefits as soon as a couple days, a couple weeks, but it isn't uncommon for people to feel benefits, 1 to 2 months out. How long will the tissue stay repaired? And of course, this is important to know. Depending on what we're treating, it can go anywhere from 5 to 10 years. And how well does this work? So for different people, different levels of success, depending on the medical problems that you've had, but depending on the levels of fitness. What really hasn't mattered so much to us was age, and a lot of people feel that age is something that may be limiting them. Not true. We've had patients well into their 90s undergo this therapy, successfully do well, continue to live an active life. So let's get into the Q&As. This is probably one of the more important parts about our webinar today. So Denise A. from area code 518 asked, how can it help with degenerative disc and arthritis pain? The way I like to describe degenerative disc is jelly leaving the donut. So those are some of my favorite jelly donuts there. But of course, when you squeeze a donut, the jelly is going to leave. And your disc is very similar in that when you compress it, there is this slow leak of jelly leaving the donut. And that's because the disc, the donut portion is no longer whole. It's got some cracks in it that just like this picture here where jelly is allowed to leave. Stenosis is the blue portion where you can see the disc pushing into that yellow strand there. And when that blue pushes in, then you have what is stenosis. For us, stem cells really is about keeping that jelly within the donut so the donut stays intact. So even though you squished it, nothing is leaving. And obviously, if nothing's leaving, then you have less pain, better motion, better quality of life, better exercise, and so on and so on. The word arthritis, however, and especially in the spine, is the combination of everything. The stenosis, the arthritis, the stenosis, the degenerative disc, the degeneration of the facet joint, the degeneration of the disc. So hopefully that explains something for you there, Denise. Tony from 514 says options for treating a bulge disc. Well, bulging is, again, jelly trying to leave the donut. It's just maybe not the same as a herniation where that's a hard squeeze of the donut and the jelly having exited. Bulging is just that jelly kind of threatening to leave. And that can absolutely still be painful. For us, the regenerative option is nice in that it's number one, natural. Again, all the cells come from you, back into you. It doesn't get much more wholesome than that. Number two, it's non-surgical. And then lastly, of course, especially for spine conditions, we're seeing lengths of time anywhere from 7 to 10 years. Heidi from 514 said, just more info. I have DDD, which stands for degenerative disc disease, that is affecting 14 discs with severe deterioration in the lumbar spine. I'd like to ease the pain, but know nothing about this treatment. And oftentimes, Heidi, it's exactly a lot of people like you who have come to found us and really been able to offer them this alternative. So previously, and you may have run into this, Heidi, is that back pain treatments are very limited. They're either very short effect or they're permanent and life-changing. And so very sometimes people have a hard time going forward with that kind of knowledge. So steroid injections, again, we talked about it before, very short effect. And then oftentimes the first injection does this, second one does this, and the third one does this. The surgery, and of course, is life-changing and oftentimes permanent. Once you do it, there really isn't an undoing of that surgery. So those are not easy decisions. In ours, apart from everything else I've described before, we are not in a hospital. Ours is all done outpatient, meaning just within our office. It's a very short recovery, typically 1 to 2 weeks. And we're talking again about something that lasts 7 to 10 years. Michelle P from 315 says, asked if I would be a candidate having two spinal surgeries, the last one in just May of 24, still in pain. Ouch, Michelle. I'm sorry to hear that. But believe it or not, for those with pain after spine surgeries, this is an excellent option. To understand a little bit why you still have pain is something we like to describe as adjacent segmental disease. Oftentimes that means when those who have spine surgeries are having fusions, which means welding two levels together. So if you're welding two levels together, you lose sort of the flexibility. That means the level above, the level below now have to improve their flexibility. They have to compensate. And oftentimes that compensation will speed up degeneration. And then, of course, you're looking to avoid more surgery. So this is a frequent reason we treat back pain after a failed surgery. Nesreen S from 514 says, I want to learn more about the field of regenerative, needing to see if I can also help my patients. So I'm assuming that you're a clinician yourself. And what I have to say about this is that it's a completely different strategy. It's not like anything else that's out there. It has a very different focus. We're really a solution, not just this temporary Band-Aid. And what we're doing is really focusing on changing the biology of pain and not just thinking about, well, how can we limit somebody's motion? So if we limit motion, then they'll limit pain. Our approach is really change the biology so that when they do go to do motion or that when they do go to do activity, it isn't going to produce that same pain. And of course, we loved saying the fact that we're a non-surgical option. Ronald M from 315 said, "Is if there is any relief for my back pain, I had polio when I was 9. This pain I developed from polio, operation in 2007 when they put appliance in my spine to stabilize my back, relief for a few years." And again, this is the whole idea of that adjacent segmental disease. Once they applied that appliance, what happens to the disc above and what happens to the disc below? I often talk about with my patients the idea of a bike chain. If you uh, make a segment of your bike chain stiff and not flexible, then the link of the chain before and the link of the chain after have to be way more flexible to make for the fact that it's got to go around these bends and turns. So for us, we are oftentimes sometimes seeing people who have pain for just months, and we've definitely helped people who have had pain for decades. So even though you say since the age of 9, and even though you've had an operation in 2007, we still feel pretty confident about these scenarios. We've helped people with congenital and both acquired back problems, as well as hip and knee problems as well. But specifically here, we're talking about the back. Aura Claire from 514 said, "I'm interested in this procedure for my husband who has debilitating back pain, live in Montreal, Canada. And because we are seniors on fixed income, we need to find out the cost, total cost, and then a breakdown of what that entails. Also, my husband is diabetic, double amputee, so we need to know about the length of the treatment and if it's possible, if large periods of time are required, whether we can return to Montreal in between treatments. Thank you." So in for us, or Claire, the consultation is critical. It's important here because we need to find out what you need, and then by the end of that, we can help you understand what that will translate into in terms of cost. Between treatments 1 and 2 and between 2 and 3, you absolutely can go back to Montreal and come back for each therapy. The timing of the therapies can anywhere be from 1 hour to 3 hours. So depending on what we're doing, how complicated the case is, these are sort of the timeframes that we're looking at. So absolutely, you'd have your therapy, go home to Montreal, recover from home, come back for the next segment. Gene H from 315 said, "I'd like to learn how and why stem cell therapy works and if there are any contradictions or any individual issues that may prevent it from working." So hopefully from what I've said so far, you have a better understanding and then therefore a ability to make some better decisions. So continue to listen, and then hopefully, if you have any further questions, we can certainly see you in consultation. In terms of the point of contraindications, there's really not that many. Again, taking cells from you back into you. We just saw a gentleman this week who was refused a knee replacement because his heart condition was too bad. And the anesthesia would probably be fatal for him. In our case, we do everything in office. No general anesthesia. You're awake. You walk in. You do the therapy. You walk home, or go walk out of here into your car and drive home. It is that straightforward. Vince from I left the area code out just because of the sensitive nature of the question here, but trouble with pain and walking as well as sexual activities. So there is such a thing for regenerative medicine, especially for sexual health. So I wanted to address that for you, Vince. And just remember that there's many parts to the whole of sexual activity. So to have functioning sexual activity, and you have to have your arteries have to be good, your neurologic status has to be good, your strength has to be good, and to keep everything sort of working. But if you're having, in addition, trouble with pain walking, this may be an indication that there's something going on with your back and your spine. So certainly for you, Vince, coming in, having a conversation with us, chatting with us, and letting us, go through that thorough examination to understand what we think we can help with and what we think we can't help with is important. Trish from 315 says treatment for bone on bone knees and bone on bone knees and disc degeneration in the neck. So, for a lot of people who hear the words bone on bone, that usually indicates some sort of osteoarthritis. It's a term that gets used a lot, and it's used to describe sort of end level degeneration and osteoarthritis. But for us, it's not a deterrent. You're still an eligible candidate. But we certainly have additional questions about you, even though you're bone on bone. How active are you? How much can you do? What kind of functional level are you? Some of these things certainly matter to us. So why don't you come and meet with us, please, and then let us understand that little bit more about you. Next, spine degeneration, as we've been talking about all along throughout the webinar, something that we are heavily focused on, that we are heavily experienced with and understand quite well. So disc degeneration in the neck is something we're very familiar with. David G from 438 says, I have issues at L5 and S1. Are you able to help? What is the cost? Is the fix permanent? So yes, L5 S1 is a region we treat quite commonly. I would say it is one of the most commonly injected discs or levels, if you will, for us. And so we've seen it respond incredibly well. I'd like to know more about you. What can you do? What can you not do? Is your L5S1, is it more of a degenerative condition, or is it something that happens suddenly, a herniation, an extravasation? For us, we'd like to understand more. If you've had imaging, what kind of imaging might you have to get? So we want to understand that. And the question about cost is a tough one. We need to first understand what you need, and then we can talk about what that may translate into cost. But a single line question over email, it's very difficult to say what you actually need. Permanence. I call this a semi-permanent strategy and solution. We're talking about 7 to 10 years, and so many of our patients have had our therapies and lived their life and said, I've forgotten that I even have pain or I've had pain. And then, of course, we're talking about 7 to 10 years of that. So that's a nice feeling. Again, comparison to steroids, which sometimes last weeks or months, and of course surgery, which is incredibly permanent, both good and bad. Andre H from 514 says, I have stenosis in my low back and ankle, and my ankle is not stable. I have no intention, even doctors won't operate on me. So stenosis indicating that you've got a problem in your spine, very comfortable. Talked about the spine and stenosis in that jelly donut explanation. The ankle, more of a straightforward joint. I understand not having stability in that, but we need to understand a little bit more. Is that because of an arthritis? Was it because a tendon is torn or a ligament is torn? The spine and the joint have very different approaches, both very successful, but we do need to understand what it is in the spine that we're treating in terms of something beyond stenosis. Is there arthritis involved? And specifically for the ankle, is that situation more of a deterioration and a degeneration? So important for us to know. And again, all our therapies are without surgery. Denise from 518 said relief of hip and back caused by arthritis. So back and neck, very similar protocols. Hips and knees, very similar protocols. For us, hip and back is one of the more complex areas to treat in the body because sometimes hip issue and back issues overlap. So even though you treat the back, you may still have a hip issue, or sometimes you may treat the hip and you still may have a back issue. So for you, Denise, coming in, talking to us, letting me examine you, let me figure out which is back and which is hip, and then that'll help me decide, do you need one therapy or do you need two therapies? Ada from 315 says, I have new pain after surgery fusions. Sorry to hear that. It's the new link and spacer put in between L3 and L2. And unfortunately, you may be headed towards this idea of something called failed back syndrome or post-spine surgery pain. We talked a little bit before about how our therapies, um, surgical therapies can speed up the degeneration of the disc above and the disc below. And so this is certainly a one way for us to treat that without surgery and simply using stem cells. Nancy M. from 518 said, how stem cells can stop nerve pain from neuroforaminal stenosis. So this is a great picture that I created. The blue is the disc, the purple is the jelly of that donut, okay? So if you can see how close the blue is to the yellow, and the yellow is nerve. So when a disc starts to develop degeneration or starts to develop a bulge or a protrusion or herniation, you can see how quickly that jelly will interfere with that yellow, which is where the nerve is. And once you do that, then you've narrowed that space of where the yellow is, and that is called stenosis. But there's a number of factors. There's also things like arthritis, which can contribute to the development of stenosis. So it's important for us to not only talk to you, but when we undergo and develop our plan with you, getting that MRI is such an important step for us. Alice from 609, do you do both knees at once? How long can I expect results to last? On average, of course. Does this procedure require a hospital stay? Is the procedure covered by insurance? If not, cost estimate. Where are the stem cells obtained? So I'll go through one question at a time. So we only do one knee or one body part at a time. And the reason for that is that it's like splitting a medication dosing. So if you take one dose of a pill and then instead of giving it to one person, gave it to two people, and they only got half the dose, it would be an ineffective dose. So we only do one knee at a time, and maybe that's why we're more successful, or who knows. But for us, we've had success with that, and so we stick to that. The longevity of the therapy in knees, particular, we expect 5 to 7 years. There is no hospital involved. Insurance, unfortunately, still does not cover these therapies. And lastly, stem cells are obtained from you. So that, again, comes from either the bone marrow or the fat or the fat, depending on what we're treating. But obviously, in your case, it would be the knees. So we would be using both. Salby O from 514 said, facet syndrome, arthritis, sciatic nerve compression, cost, downtime, success rate. So for facet syndrome, that's the big joint in the back, and you can see as that small yellow nerve, as it starts to curl around, that's about where the facet is. And that's the joint in the back that helps to help hinge from one vertebrae to another. So if you said this is a vertebrae and this is a vertebrae and what's in between is the disc, that's what we call the facet, right where the fingers would meet. And so arthritis and sciatic nerve compression are all things that go along with this. So again, to understand costs, we'll have to understand what you need. In terms of downtime, expect 1 to 2 weeks, a lot of times with therapies that happen in the spine. Success rates are excellent for these sort of issues, but some of this is, again, specific to you. So we'd really like you to come in, help us understand your function level, your activity level, what you're looking to achieve. Eddie from 514 said pain management and stem cells for arthritis in the wrist. Yes, regenerative medicine. It's virtually everywhere you can imagine. So we've done it everywhere from the neck down to the toes, and elbows, fingers, hands, you name it. Elizabeth from 518. I'm just interested in what it is all about and how it works. How do I know if this is right for me? Costs. What insurance, if any, would cover all or at least any of it? So the consultation is critical here. We really have to review your specific issues, your specific treatment options, and your specific needs, and then obviously from there you can choose. You can choose what makes most sense to you. And of course, unfortunately, insurance still does not reimburse for these. Stephanie from 518, options for severe hip and groin pain. Believe it's tendon, not bone. Osteo diagnosis 20 years ago. So I think if you mean osteo, maybe osteoarthritis or osteoporosis. I'm not sure there. So the hip tendon works very, very well to our regenerative therapies. And sometimes that's PRP, sometimes that's stem cells that we sometimes won't know until we actually do the MRI. That's one of those few locations we won't know just from talking to you and from examining you. The activity limitations are sorry. The question to you is what sort of activity limitations do you have? Is it with sitting? Do you have any imaging? Obviously, seeing us in person will help us do an exam and know what it is that you need. A lot of hip questions on this time around. So Mark B from 514 said, "What are the options for hip problems? Regards." So for you, Mark, is it arthritis or is it tendon? Whereas our last person here, Stephanie, felt it was tendon. With you, is it more arthritis or tendon? Maybe both. And so for us, location is critical because we can have a diagnosis that means we know where we're placing the therapy, where we're locating the therapy to. For these sorts of therapies, precision and accuracy are critical. If you are not getting precision and accuracy with where these cells are placed, it is a waste of time and money and effort. One more hip. Daniel from 716 says, look forward to learning more and beating arthritis in the hip. So hip arthritis works quite well. I'd certainly like to understand the level of staging for you, as well as your functional status. For us, in a lot of times when we're talking about joint pains, and whether that be the knee, the hip, or the shoulder, we're really talking about a bony pain. We're talking about swelling that occurs within the bone itself. And so what I have down here is IO. One of the things that we do, and which isn't that common, is that we will actually place stem cells and platelet-rich plasma into the bone and not just the joint. So in addition to the joint, we are also placing stem cells into the bone. And yes, that means even of the shoulder, even of the hip, the knee, the ankle, the elbow, the thumb. This is oftentimes a critical piece of what we do. So there you learn something that we oftentimes are uh, always talking about. Gail from 315 says, I have lower back pain, not sciatica, keeps me from standing to do anything such as walking much, doing household work, making beds, sweeping floor, mopping, etc. I have to go sit down and the pain subsides and have no back pain. Quite a while ago, diagnosed as arthritis and/or osteopenia, but it's been terrible last year and seems to be getting worse. I also get right hip pain, left knee pain. Feel a need for an update on what's going on. 71 years, avid golfer, gardening, mowing lawns. Till about a year ago, with these issues gotten worse. So what you're talking about when you do activity and have to take a break and then feels better and go to do things again, that sounds pretty suspicious for stenosis. So I picked a picture of a tunnel here because oftentimes it is the disc holding that tunnel open. So a degenerating disc means that the tunnel's shrinking. So for us, being able to do an MRI in-house, being able to make that diagnosis, understand that, and then direct our therapies exactly at where the MRI shows us, has been quite an advantage for us. Georgiana from 514 said 50-year-old female suffer from degenerative disc disease, as well as multiple disc herniations in the cervical, thoracic, and lumbar spine, severe spinal canal stenosis, as well as severe neural foraminal stenosis. I'm wondering if and how stem cell therapy can help. Also, I'm located in Montreal, and although I see the website has a Montreal phone number, I believe Dr. Kim only sees patients in New York State. So, couple of points here. Number one, stem cells help in two primary ways. Number one, it helps with inflammation. So where stem cells get injected really help reduce the level of inflammation. So if you have less inflammation, you have less irritation to sometimes the spine or the disc, or whether it's the knee. So that cutting down of the inflammation will help you do more things without that block of inflammation. Number two, it helps with integrity. So when we're talking about whether it's well, we talked about injecting in the bone, but in this case, we're talking about the disc. If we can help improve the quality of the disc so that it can keep more jelly in the donut, you can imagine when you stand, when you walk, when you do things, you can sustain activity for longer. So we're talking about the relationship of the disc to the bone here. A little red circle says cartilage end plate. And that's how a disc receives nutrition. Nutrition for a disc actually happens through the bone, through the cartilage end plate, and then into the disc. The disc itself does not have its own set of arteries, own sets of veins. That's why when it degenerates, it continues to degenerate. My favorite analogy is like a cabin built in the woods. If there's no road to it and it starts to break down, very difficult to fix, just hard to get to. But stem cells and PRP is like developing that road so that you can develop or so you can deliver the nutrients in order to have it improve. And yes, that is a part of aging. And so it's something that we see, in fact, reversing in a lot of people. Joanne from 4013 says relief of back and hips pain. So back and hip, we talked about this a little bit, where the overlap between back and hip. So sometimes what is back looks like hip, or sometimes what looks like hip is actually back. So for you, we really need to understand, do you have one? Do you have the other? Or do you have both? And of course, because of the overlap, very difficult to say over the phone or over the computer here. So a consultation can really help us understand which one of these that you have. Okay, next slide. Oh, sorry, that was Georgiana again. Natalie P from 514 said, I'd like to know if stem cell therapy is right for meniscus tears. Yes, we can help. So meniscus tears are something that we treat often. We see quite frequently. They respond very well to stem cells. It helps save the meniscus versus doing something like surgery. And why I bring that up is oftentimes when you see a meniscus and it has a tear in it, the surgeon just simply cuts around the meniscus. And so you have less meniscus, but then you also have no tear. So for us, it's not so much about trying to make sure that the tear goes away, but help stabilize that tear with stem cells. Because once you lose the meniscus in that area, the bones meet more often or meet harder. Studies have shown that you are 6 times more likely to develop the need for a knee replacement. And for some people, maybe that's not that important, but for a lot of people, including myself, being able to keep my cartilage, keep my meniscus, and avoid surgery is important. We have our ovarian MRI, which can help make that diagnosis as well. David from 518 said simply shoulder replacement alternative. So for a shoulder replacement alternative for arthritis, the what we do with stem cells significantly reduces pain, improves mobility. This is the shoulder replacement alternative. The limitations of surgery are is often done in the hospital, long recovery, significant impact on the quality of life afterwards, how much you can lift and the activities that you're allowed to do, how much you can raise your arms, etc. But obviously important for us to meet you, Dave, and have that consultation. Sue from 315 said if this therapy would work for me. So let us get to know you, Sue. Come on in. Let us understand what hurts. Where does it hurt? How badly does it hurt? All of these things are critical pieces of understanding for us. If we understand you better and understand what you're trying to do better, we can tell you, yes, we can help you achieve these goals. Or look, if you're looking to be in the next set of Olympics in Los Angeles, that might be a taller order. And of course, whether or not you've had any imaging, but even if you haven't, we can help you with that. Sue, again, question. So next question from Wendy and Paul Z, back and neck pain. They both asked the same question. So we treat both. We are unique in that we do an intradiscal cervical spine. So we may be one, if not the only, in a pretty wide set of geography here that is introducing stem cells into the discs of the neck. And for us in our office, our results have been amazing and just been able to get people to a higher quality of life and avoid that fusion. And if you know anything about the fusion of a neck, they cut you in the front and apply the screws and the plates from the front. So, obviously it's a pretty big deal, pretty big surgery, but this would help us help you avoid that. But got to come in. Let us learn more about you. Pam from 315, Isabel from 514, Mary Jane from 518 asked some similar questions here. Procedure and aftercare, details on the procedure and recuperation period, what the procedure involves, and the recovery time. So for us, what we've seen in our office is that if you go back to the original graph and the timeline, the first and the third treatments, very little to no downtime. For us, after the second, that's probably where we see the most amount of downtime. It's going to take you probably a full week to recover. We recommend staying from home and following our instructions. We recommend some gentle motion, no heavy lifting, no long walks. Pretty basic instructions, but at the same time, pretty important that you follow. But again, simple, not complicated. You're not taking care of wounds and dressings and complex things like that. Kathleen from 518 said, can stem cell help back pain from spondylolisthesis? I have bone-on-bone arthritis in both knees and the back problem. I'm in pain. I also have neuropathy in both feet and ankles. Is there help for either my back or my knees with stem cell therapy? So the answer is yes, and yes, and yes. So when we talk, for those who don't know what spondylolisthesis is, let's see, if you have two vertebrae that are stacked on one another, spondylolisthesis is when one bone shifts and forward on top of another bone. What we often see in spondylolisthesis is if you go back to my picture of that red circle and cartilage end plate, by shifting forward, that connection between bone and the disc are interrupted. Again, bad nutrition, lots of degeneration, continually worse. So for us, being able to put stem cells back into the disc is not going to shift your bones back, but it's going to help that disc be better, have better integrity. Again, less jelly oozing, better motion, better motion tolerated, more flexibility, more activity, more exercise. John from 518 said herniated disc with sciatica solutions. So the sciatic nerve is a wire, and it's a wire, if you can imagine, that runs underground. In your case, inside of your body, as down the leg. This wire is responsible for pain, strength, and weakness, burning, numbness, tingling. In you, John, it would be the pain. But when the wire is interfered with, imagine if there was a tree root or a rodent that ate through the wire, then you get one of these unfortunate consequences: pain, strength, weakness, burning, numbness, tingling. But where that tree root comes in is different. So is it early on in the wire, or is it middle of the wire, end of the wire? And this is where understanding whether it's degenerative disc disease and arthritis, or is it a stenosis problem, or is it a muscular problem that's leading to the sciatica. So very important that we get to meet, very important that we get proper imaging and understand where your pain's coming from. Again, location, accuracy, precision. Dennis from 514 said non-surgical treatments for treating arthritis in the spine and hip. That's exactly, this is exactly what you were looking for. It is a non-surgical solution for your spine and hip. So degeneration and arthritis are things that affect the spine and the hip, and it's progressive, unfortunately. Two very different protocols between what we do in the spine, what we do in the hip. But obviously, when we get through a consultation, we'll review all of this with you. Heidi from 518 said, just more info. I have degenerative disc. Oh, we talked about the 14 discs, severe deterioration. James from 585 said, how to make my life more livable. Devastating pain, sciatic working all the way down my leg. So, James, it's quality of life. Sometimes it is just those simple things. And sciatica is as you saw what I said before, it's the wire that's running underground. Where is that wire pinched in you? And where is that tree root hitting the wire? And can we do something about it? And we certainly think, degenerative disc, stenosis are some pretty common reasons and reasons why that we can help you, but better understood through a consultation. Regina from 518 said, I'd like to see anything related to neck disc damage relief as well as meniscus tear and rotator cuff tears. Thank you. So treating the neck, the meniscus, the rotator cuff, all are things that we can treat, that we have treated and treated well. These are things that people come to us frequently. So damaged disc in the neck, a meniscus and rotator cuff, that's like the classic American trio, right? This is something we all suffer from when you've lived long enough and had an active enough life. They are all approached differently. Sometimes a little bit different, sometimes vastly different. So, for example, the rotator cuff tear doesn't follow that same three injection schedule. The meniscus involves fat, the neck does not. So a lot of this is quite different, but we've fine-tuned our approach for each one of these things to maximize the outcomes here. Maureen's from 585 says success rate with DDD, scoliosis, and arthritis. So a lot of factors affect success. So we'll talk about that here for a second. Whether or not you've had spine surgery matters. The level of physical activity that you can sustain matters. The severity of the spine matters. Again, some of the things that don't matter is age. So people are oftentimes surprised by that fact. But we've treated enough people in their 90s and seen them and done well and felt that age was not a factor, in fact. Okay, here's a long one from Carol from 585. Lower back pain. Having pain for the last 16 years, for which I received epidural injections and wearing for the last 16 to 20 years. At URMC, which I is assuming is University of Rochester Medical Center Pain Management, they helped from the start, but after so many years of treatment, epidural lost its effect, which is what we talked about, right, with steroids having sort of less and less effect. Thought I could manage the discomfort pain I was feeling. Couldn't. Actually, reason I left pain management was because the two doctors I saw there left. I know I don't want surgery. So what's left? I forgot to mention that I will be 90 in April 2025. Another reason to not wanting surgery. Understandable. Without seeing me, is there hope for lessening the pain? I saw your ad in Good Health newspaper and I thought I would look into it and see what you had to say. To be clear, this is not signing up yet. Understood. So being 90, mm, watching somebody who's had lessening effect of epidurals, one of my questions would be, is this in fact degenerative disc disease? To which my guess is going to be pretty high chance that I'm right. Age, I said it multiple times before, age doesn't affect us. 90 years young is what we would say. We just saw a 94-year-old in consultation this week, so it's something we know, and we were able to offer this therapy to him. So there's definitely hope. We'd like to do that consultation, go over each step of the procedure, what to expect for you, and what, if anything, may be different when you're 90 versus when you're 50 obtaining these therapies. We're talking about, again, a therapy at 7 to 10 years of relief. So maybe at 100 you can come back and receive the therapy again, and maybe you'll be our first centurion, and we'll see. Gene from 315 said, would stem cell therapy help my spinal stenosis? So yes, we do treat stenosis. Stenosis and degenerative disc and arthritis are all very closely linked, and we talked about this before. So the blue sort of encroaching into the space of yellow in one of those early spine diagrams usually indicates treating the disc oftentimes helps the stenosis. So yes, the stenosis is a secondary effect if you look at the root cause of the issue of why you're even developing stenosis and focusing our energy to there. I want to know what you can do. What can't you do? What's your strength level like? What kind of imaging have you had? Janet from 315 said solutions for leg weakness and pain from chronic back pain. So before, the other person was talking about pain as their issue. And this person, the sciatic issue may in fact be the reason for their weakness. Again, where is this wire being interrupted? Where is the tree root bothering this nerve? And not everybody who has a sciatic issue shows up with just, the same profile. Some it's pain, some it's burning, some it's weakness. Everybody is a little bit different. Natalia from 518 said, I'm nearing my own treatment and would love to know everything possible about the procedure, pre-procedure, the prep, procedure overview, how it actually works, risks and benefits, recovery expectations. Merci. So hopefully by this point in time, Natalia, you saw the procedure, the pre-procedure, how it works, the risks, the benefits, and all of that. And hopefully we're able to cast some light on that. Pam from 518 said, does the treatment work for people who have already had surgery for degenerative disc disease? Does it also work on knees? So again, excellent therapy after surgery, because the last thing if you've had surgery and had it not work is to have yet another surgery, and the likelihood of that working is obviously pretty low. So you may be developing this thing called failed back syndrome. You may be developing adjacent segmental disease, again, which we absolutely target with our stem cell therapy. Knee, and for knee, I would probably say some of the best results, and not some of the best results because the hip and all these other places are not good, but the knees have been looked at probably the most frequent. But that's also it depends on what walks through our doors, and so knee pain walking through our doors is pretty common. Fran from 514, what are the treatments and costs? So to that, I say, let us get to know you and what you need. Need equals cost, so it really depends on you. Consultation helps us understand what's going to work best for you. Donna from 781, is the stem cell same as PRP? So both are regenerative therapies, and hopefully at this point in time, I've helped separate the two. PRP stands for platelet-rich plasma. This specifically is coming from your blood. Um, this is typically reserved for that green and yellow, sort of lower level problematic issues where, stem cells was for that yellow and red. There's pluses and minuses to doing platelet-rich plasma. It's shorter, it's simpler, it's oftentimes less cost. Stem cell, however, is oftentimes taken from bone marrow or fat, so it's more of a denser tissue, if you will, not just simply blood. And again, there's pluses and minuses to this. But again, going over what you need and what makes the most sense, what we have seen in terms of success for your problem that you show up with is going to be a big part of this conversation. Marilyn says everything and anything, from 518 said everything and anything, knowledge is wealth. I cannot agree more with you, Marilyn. So thank you. Anna from 514 says simply sciatica pain. Hopefully, at this point in time, you do have more information, Anna, and then that will lead you to a better decision as well. All right. Finally, we're at the end. So for any webinar attending, my offer to you is a free consultation. And if you call by Friday at noon and mention webinars, we will offer this consultation to you. If you are not sure, want to watch more consults, or you want to share this with others, the next webinar will be March 19th. Phone numbers 518-871-9900 for those in New York, and those north of us 514-697-8919. You can always learn more at richardkimmedicine.com or /webinars to watch either past webinars or to sign up for futures, and /MRI for those who are looking to schedule their own MRI ahead of time. So, which, we certainly encourage and allow as well. Okay, so let's see if I can get to some questions. So far, 2 questions. Number 1 comes from Daniel Johnson. Diagnosed with osteoarthritis in the hip, been teaching tennis over 30 years. Now have leg length discrepancy, really painful, needing a cane now. Can the stem cell treatment help? Thanks, Dan. So yes, even though you have a hip osteoarthritis, we can help. What it isn't going to change is the fact that you've got this leg length discrepancy. So if one side is longer and the other side's shorter, it isn't going to necessarily grow one leg and fix that leg length discrepancy. Sometimes the leg length discrepancy can be fixed with just simply a shoe insert. I'd have to know exactly how big of a leg length discrepancy it is. Studies have shown that after only certain uh, differences and above are worth fixing, and certain discrepancies and below not worth fixing. Natalie, probably not saying that right. Can the consultation be done via video call? Yes, absolutely. So something that I haven't mentioned, but you can make your own consultation online and choose video. or if you call and set up a consultation, it is absolutely an option for you. So that is definitely something for those who are out there or who live further away and not yet sure about traveling all the way to us. Obviously, we want to try to get some information, guys, more as much information as possible. So if you have X-rays, MRIs, discs, things that you can send to us ahead of time, or fax to us, or email us, that obviously helps me going into the consultation with as much information as possible. Next is Isabel Rassett, who said, I'm so scared of needles. Is it painful? I've done one cortisone, but that's it. Yeah, I mean, it's a good point. I'm scared of needles too, which is, kind of funny, right? But it's impossible to do without the needles. So I will tell you that I think I am the best person with needles. Um, After having injected, tens of thousands of people, we're pretty good at making that whole process as comfortable as possible. We did multiple stem cells today. Nobody cried. And we played nice music. Some people fell asleep. So as you can imagine, it's very well tolerated, and we do our best to make sure you tolerate it. Next is Natalie again. I have a tear in my left supraspinatus tendon and also bilateral meniscus tears in the right knee. Oh, got a lot going on there. If I choose to go ahead with the treatment, will both be done at the same time? So the answer is no. So we're going back to what I was saying before. We treat one body part at a time. It's like taking a medication dose and splitting it between two people. Neither person gets the full dose. We want to make sure we use enough cells for each problem. Because if you don't use enough cells for each problem, then it isn't going to have the maximum effort to heal. So we want to make sure in each scenario that happens. Okay. All right. So no more questions yet, but I'll hang on here for anybody else who has um, a burning question that wants to be asked. All right. No questions coming through. Obviously, if you guys have more questions, please bring them at the consultation, whether it's video or in person. Thank you for taking time to attend this webinar, and we hope to see you guys in person. Thanks, you guys.